Good morning. I'm pleased to see you today.
Good morning.
Yeah. Please, what's the name of your lab?
It's a histology lab, histopathology laboratory, Delsuit.
Okay. All right, histopathology lab. All right. Please, can I know your name, sir? Your name, the name of the industry-based supervisor?
Mr. Alexander Mwachukwu.
Okay. All right, that's good to know. All right. Can I see part of your lab? Maybe just show the video. Let me see. Okay, that's good. Can you, will it be possible for you to find a seat there for us to have the supervision?
Okay.
Yeah. All right, thanks. I've seen it. So I would like to speak with you alone first. I mean, the industry-based supervisor before discussing with the student.
Okay.
Yeah.
Okay, you want to speak with me alone before she comes in?
Yes.
All right.
Yeah.
All right, no problem.
Yeah.
I'm listening.
Okay. Well, can you adjust the camera? Okay. Yeah. All right. Thank you very much.
I'm trying.
Thank you very much, Mr. Alexander, for making our time for this online supervision. Actually, I'm very happy and appreciative of the fact that you accepted our student and have done well in training her. And so please, I want to know the tests you have taught her so far in your lab.
Well, basically, what we do in histopathology here is histopathologic tests and cytopathology. Basically, that's what we do here.
Okay, histopathology tests.
Okay. And cytopathology tests.
Okay, and cytopathology tests. So the histopathology tests, which types of tests specifically have you been doing in histopathology tests? Can you tell me specific tests and procedures? Because that's what I'm going to examine her with.
Okay. Basically, histopathology is not like the rest of the other laboratories.
Okay.
So what we have here is, when I say histopathology tests, for now, what we do here is just general demonstration and study of tissues.
Okay.
Then I think that's basically the most she got exposed to. Okay. Because my colleague actually handles cytopathology while I handle histopathology.
Okay. All right. So how do you analyze the samples, or what kind of samples do you hand? You said it's tissues, right? Tissues from patients or from animals, other animals, and plants? Okay,
from patients. The medical laboratory. Yeah.
Okay, it's a medical laboratory. All right. So what kind of tissues do you analyze, and what's the procedure for analysis?
Well, tissue varies from brain tissues to tissues from different parts of the body, bony tissues even.
Okay.
You have breasts, you have ovaries, you have uterus, you have cervix, you have vaginal lumps, or rather tumors. You have different tissues. It could come from any part of the body. We have prostate samples also.
Okay. All right. So look for infection in those tissues. All right. So how do you collect the tissues, and how are they analyzed or checked for
Okay,
possible
tissues are collected
infection?
surgically, and
Okay,
then they go through these. There are processes involved, histological procedures before they get to be analyzed. And the areas she got exposed to were the areas of costing and these procedures, the processing procedure.
okay.
Those were the areas she got exposed to.
All right. So, for instance, if you have a brain tissue to check for possible infection, so what's the procedure?
I,
That's what
I
I
didn't get
want
that.
to.
Please come
I mean,
again.
the procedure. For instance, if you have a brain tissue or a bony tissue or bone tissue, what's the procedure for checking or for diagnosis?
Okay. Okay. Well, immediately the tissue is harvested or removed surgically. The first thing is to fix it.
Do
Then
you do
after
it there
fixation,
in your lab or it's brought from the hospital? Do you collect the sample surgically from in your lab or it's brought from the hospital?
no, you don't perform surgeries in the lab.
Yeah, I know.
It's the theater.
Okay, so
In the theater.
yeah, I know. Okay,
Okay,
so
so
the procedure for the
yes. After
diagnosis.
fixing, after fixing the tissue, the next thing is to, if it's a
So,
bony tissue, the procedure is slightly different, but remains basically the same. If it's a bony tissue, you decalcify first before you continue. After
with
that,
what?
you
I was told you do histopathology and cytopathology tests in the lab.
Yes, sir.
All right. So, can you tell me how a bone tissue is being tested for maybe cancer or any other disease?
Tissue tested.
Bone tissue. Bone tissue, bone tissue.
Okay, sir.
What's the procedure for diagnosing whether a patient has cancer using a bone tissue? How do you
Okay.
check?
First of all, we do fixation. When the bone is being brought from the brought to the lab, we do fixation. That's putting it in formalin.
Okay.
Then after that, we do clearing, dehydration, and the rest. But if it's the bone, we use a synthetic chemical called xanine
Okay.
to test for it here.
Okay. All right. So after using the xylene, what is it used for? For clearing?
No, the saline solution is used for like to put it inside. The clearing is different because clearing has to do with different procedures. From moving it from aqua 1, 2, 3, then xylene. After that, you have to do embedding, the other procedures to do for that bone.
And tell me the
Bone
procedure.
procedure.
Tell me
Okay,
specifically.
we have the first one is fixation.
Okay.
So that's putting it in formalin so that it won't get spoiled.
Okay.
Then the clearing is like grossing. Then we have to cut up, that we call it cut up here, just to cut it up, like to take the sensing part we use for the test inside the bone.
Okay.
Then after that, we have to put it in something like this. Wait, I'm going. Something like this, which we call cassettes.
Okay.
Cassette here.
Okay.
So when you put it, then we put it for inside the formalin for an hour.
Okay.
So after an hour, we have to switch it from formalin to aqua 1, aqua 2, aqua 3. Then we move it from alcohol 1, 2, 3 to xylene.
Okay.
In the next page.
Please hold on. Go ahead. Go ahead, please.
So we put it in, after removing it from xylene, then we use nitric acid.
Okay.
Yeah, that's after fixing and everything.
Okay, put it in nitric acid.
Yes, sir.
All right. So after putting it in nitric acid, what else?
After putting it in nitric acid, then we dehydrate it.
Yeah, that's the dehydration.
Yeah, that's dehydration.
Okay. With alcohol, you dehydrate with alcohol, right?
Yeah.
Okay, then after doing that, just tell me the procedure to the end.
Okay, after doing dehydration, we have to embend.
Okay.
We have to do embending.
Okay, using what? Using what now? Your camera is not showing your face properly.
Okay, sorry, sir.
Okay.
I can't hear you, that's why.
All right. Okay, so you embed with paraffin wax.
Yes, sir.
Okay, then after that.
And after that, we do microtome. Microtome.
Go ahead now. What do you do in microtomy?
It's a machine, sure. Like this machine. The machine, we use it like in shaping the.
Is it to do
Use it
what?
from the artwork. Like when you've done embending, that has to do with putting it in an artworks.
Okay.
Then we allow it to cool. After it cool, remove it from inside this stuff, this cassette.
Okay.
Then we put it in the microtome to shape it.
Okay.
To give it shape. In the hand to put it in a right shape. Then after that, we leave it for some time before we use the normal impregnation. And moving it from one, that's this different stuff here. Then we have to move it to each chemicals here.
Okay, go ahead.
So after moving it from each chemical to the end, that's
okay.
Can you see me, sir?
Yeah, I'm seeing you. Go ahead.
Okay. After you move it from all these stuff, then we have to, after staining it, then we have to use put it in a slide.
Okay.
For microscopy.
All right. So quickly, let me see your logbook.
Sir?
Your logbook, please.
Oh, my logbook. I didn't bring it to work today.
Why? But I told you I was supposed to be supervised today.
Sorry, sir. I didn't bring it along.
All right. You're supposed to do that. So maybe we'll schedule another meeting tomorrow.
Tomorrow.
Mm.
You won't be around tomorrow.
Just two of us. Just two of us.
Okay, no problem, sir.
So that I'll see a logbook to assess you.
Okay, nothing. No, right. No, it doesn't need it. So do you still need him because he's going for the meeting?
Yeah, let him go. Let him go.
Okay.
All right. So, what the technique that you use in this entire process? What is it called?
Sir?
What is the technique called?
For the entire process? That's called tissue processing.
Tissue processing.
Yes, sir.
Okay. All right. So what does dilute hydrochloric acid do to the sample?
Dilute
Hydrochloric acid.
hydrochloric acid.
Mm.
That's
What do you use it for? Or nitric acid. You use dilute nitric acid or dilute
okay.
hydrochloric acid. What are they used for?
That's to help like that's to help the bone stand like how do I put it? To make the particles firm and okay. So
All right. Thank you very much for your time. I would have another meeting with you tomorrow. I'll have
okay,
a
sir.